Hello, I'm Cheryl Hawkins. Welcome to Solutions, the show that highlights the incredible work that nonprofits do every day to find solutions to problems that challenge our communities. Sickle cell disease, also known as sickle cell anemia, is a rare genetic blood disorder. The disease affects more than 100,000 people in the United States and 8 million people worldwide. In the U.S., 9 out of 10 people who have sickle cell disease are of African ancestry or identify as Black. It's a lifelong illness with painful episodes that may be managed through preventive screening and treatment strategies. On this edition of Solutions, we are focusing on the Armstead-Barnhill Foundation, a family organization committed to supporting and advocating for sickle cell anemia patients and their families. Working alongside other partners in research and medicine, they help to advance new discoveries for treatment and provide financial support to ensure patients living with sickle cell anemia have access to those available treatments. Joining me in studio to talk more about the Armstead-Barnhill Foundation and the work they do are Andrea Armstead, attorney, co-founder, and CEO of Armstead-Barnhill Foundation, and Linda Armstead, a medical technologist and the Armstead-Barnhill Technical Support Director. Ladies, welcome to Solutions.
Thank you for inviting us on today. We appreciate it.
I am so happy to have you here to talk about this very, very, very important issue and how it's affecting people of color. So, Andrea, I want to start with you. How did you first learn about sickle cell anemia?
Well, sickle cell has been in my life since I've been born. My sister, who is just a year younger than me, was diagnosed with sickle cell at age 6 months.
Yes. Wow. And so at 6 months, they were, I guess, knowing about this disease then?
Sickle cell is one of the rare disorders that actually has the cause, the dedicated gene that causes sickle cell was discovered in about 1910, which is quite a long time ago. If you all know, if you can find the cause for a disorder, you can then work towards a cure. So sickle cell is one of the disorders that had the cause identified early, but nothing happened for years and years and years. So that's one of the problems that we have with education about sickle cell disease.
Right, and so Linda, tell us, what is sickle cell anemia?
Sickle cell anemia is a hereditary blood disorder, and so you're born with it, but because of protective hemoglobin, F hemoglobin, fetal hemoglobin, you don't start, it doesn't wean off till 6 months of age, and then that's when symptoms start for the sickle cell patient. And some of the symptoms are pain in the joints, the knees, the hands, the elbows, stomach pain, back pain, leg pain. So you have a lot of pain, and usually that's the first signal to a parent that something's wrong with my child, and they take them to the doctor to be diagnosed.
Right. And so sickle cell anemia is an inherited disease. It's possible to have the trait and not have the disease. What does that mean exactly?
So sickle cell trait puts you in a carrier status. So I have sickle cell trait, and you want to know if you have that status so you can make a determination as to whether your partner has and is a carrier, has sickle cell trait. For sickle cell anemia, since it is inherited, you have to have both the mother and the father be a carrier. And then you have the chances of receiving or getting a child with sickle cell disease, a 1 in 4 chance.
So you have the trait.
I have the trait.
And you have the disease.
I have the disease, yes.
I'm going to come and talk about both of them, but with you, with the trait, you have a daughter, Leah, who also has the disease.
Right.
So both you and your husband have the trait.
Right.
Now, did you knew that?
I knew it, and frankly, I was hoping 1 in 4, we would be.
That she would not have?
She would not have
Now,
it.
that's possible to both have the trait and the child.
Oh, absolutely. It's just a 1 in 4 chance.
Oh, wow.
A 25% chance that if you and your mate, your husband, have the trait, that you'll have a chance of getting sickle cell disease inherited.
Okay. Wow. And so you rolled the dice and...
I rolled the dice, but I also received a lovely gift from God, who's our
yes.
daughter. So it's a lot that folk with sickle cell trait have to go through.
People with the disease have crises or episodes, as they're called. You said the pain comes. Talk about how it feels. It's bad.
It's very bad. And what happens, the cells are in that area have clumped up. And so now blood vessels, the blood can't flow through to give oxygen to the other parts of your organs that need it. The whole body needs the oxygen. And since that blockage is there, that causes the pain, and the pain is severe. And a lot of times when you go to the doctor, they'll give you like morphine to help control the pain. So that's how severe it is.
Pain.
It's serious pain. Yeah. And I'm one of those people. I don't do too well with morphine, so I try to have something else to help me with my pain.
So you've lived with it all your life.
Yes.
How often, and do you have these episodes as much as frequently now as when you were younger? I don't know what the medicine was like back then to treat it. I'm sure it's advanced today, hopefully.
It has advanced far. The only medicine that I really could take was like aspirin or Tylenol if I didn't take the morphine, because I couldn't take it too much. Yeah, the advances in medication have improved, and there's hydroxyurea now that a lot of sickle cell patients can take. I'm one of those sickle cell patients that can't take hydroxyurea, so I am on what they call a chronic exchange transfusion, which means I get a transfusion every month to help get rid of the sickle cells and put in new blood cells to help me deal with the pain. As if you can flush away the sickle cells, you're doing a whole lot better in reducing painful crises.
Okay.
One thing you want to understand is that sickle cell is a very specific individual disease.
Yeah.
Okay.
So while Linda may have a set of symptoms and complications, someone else will not have the same ones. So each case is really on an individual basis, and your medical provider is the one who, helps you to get through the complications. What Linda didn't mention was that in addition to pain crises, the sickling of the cells impact organs.
Yeah.
So it's a possibility of a stroke and damage to the organs. So it's very complicated disease. But some folk, manage incredibly well, and others have a more difficult time. So, we're advocating for more education. So, we have folk who talk about the disease, but also so folk can understand that it is an individual disease.
Right. I want to get to the foundation before this segment is up, but I want Andrea, if you can share with me your experience with your daughter. And I know as a family that's traumatic, but how did Leah come through this? Had treatment advanced even more for her?
Well, Leah is in her 30s now, so we've had leaps and bounds in terms of progress for therapies and a potential cure. But Leah had her first crises at about age 2, maybe. She just sort of hobbled around. I'm like, oh, what's going on? And she was having a pain crisis in her leg. But she was then followed by various institutions, medical institutions, and has had an opportunity to take hydroxyurea, so she can take it, whereas again, Linda cannot. And the hydroxyurea has been a therapy, a pain management therapy that has allowed her to excel in high school, excel at Georgetown University, and excel at Johns Hopkins University, and is now a nurse practitioner.
Wow.
So, we always try to give a lot of hope and just encouragement, not only to the sickle cell community, to the sickle cell warriors, but also to the medical community about education and the fact that we need you guys to continue to find therapies and a cure for sickle cell.
And you did much more than, talk about it. You and your husband founded the Armstead-Barnhill Foundation. Talk about the foundation and what forced you or made you commit to it.
So as you can tell, I talk a lot. And when Leah had one of her first hospitalizations, she, there's your little baby in a hospital with machinery and doctors and nurses coming in. And for the first year, I sort of boo-hooed. The second year, I said, I do talk a lot. I know how to advocate for myself and for others around me. We can definitely advocate for our daughter, and we can learn as much as the medical profession can in terms of just what to do to keep our child healthy and happy. So we started the foundation to educate, to support medical research, and to assist the sickle cell families in any financial way, and just support an emotional way that we could. So that's how the foundation got started in 1993.
Wow.
It's all volunteer, and it's been a labor of love all the way up to this point.
And so what do you do to advocate? Who do you talk to? What is it that you do?
I actually talk to everybody on the street that I see. I talk to people in the airports, but no, we come on shows such as this, Solutions, to help find solutions for the problem.
Right.
We, anytime we're asked to speak, we, definitely speak. We give out grants, and I'm so excited about this. We give out monetary grants to researchers, to the medical community for medical equipment, and what we've started this past year is actually giving out assistance to medical institutions that help the sickle cell community address unmet needs. And
no, go ahead.
An unmet need is one that you may not even think about. When you have your child in a hospital, you are losing time from work if you're sitting by the hospital bed. So that's your income, or half your income gone.
Yeah.
So then most people live paycheck to paycheck, especially in, a community that is not necessarily economically able to meet unexpected circumstances. So you have to then make a determination as to whether you're going to pay your gas and electric bill or use the Uber to get to a hospital.
Right.
You have to sometimes miss your rental payments
because
you're trying to deal with co-pays or the medicines that are needed when your child comes home. You have to put food on the table, and we all know, SNAP had a major impact on the sickle cell community. And Armstead-Barnhill actually is in the process of sending monies for coupons for food assistance so folk can get through this time period.
Wow. So how do you find those people who need your services and those research centers or whatever that you're giving grants to? You must be really busy searching and keeping up with what's going on to be able to identify where that help is needed.
A story I always like to tell is that years ago, over 30 years ago, we had a Yellow Pages, and I was in my home shifting through this Yellow Pages to say, we don't know this community. We don't know doctors and researchers who do sickle cell. Let's look in the Yellow Pages, because that's what you did. So I flipped through and found Dr. George Dover, who was a sickle cell researcher at the Johns Hopkins Hospital. Literally called this man up cold and said, hey, we have a foundation for sickle cell. We want to talk with you, find out what you're doing, and hopefully give you a grant. He was in a cubicle in the back of Johns Hopkins. He addressed us and became the head of the Johns Hopkins Children's Center, and we have since been supporting Johns Hopkins because of that phone call.
I love it. We're going to talk a little bit more, but we're going to take a short break right now. We have so much more to share about the important work of the Armstead-Barnhill Foundation, so please stay with us. We'll be right back with more solutions.
Let's face it, there's a lot you don't know about sickle cell disease.
That it's not contagious.
It's hereditary.
That it can be unbearable.
That you could have the gene that passes it on to your children,
but not even know it.
And that there's a simple test so you can know it.
Let's face it, there's a lot you don't know about sickle cell disease.
And that's a disease too.
Call the 211 info line to learn more.
Welcome back. You're watching Solutions, the program that highlights the great work of nonprofits in our communities. On this episode, we are talking with Andrea and Linda Armstead about the Armstead-Barnhill Foundation, an organization created to support individuals and families who live with sickle cell anemia. So when we left, we were talking about services and help that you give to people, those unmet needs that people have. Share a little bit more, because you talked about sometimes people can't afford to get to the help that they need.
Yeah, it's really heartbreaking because, again, you have a parent whose child clearly needs medical assistance. People don't think that if you don't have a car, or even if you do, you've got to put gas in that car. You've got to secure an Uber or a taxi cab. Who's going to pay for that? And when you're living paycheck to paycheck, you really have to make determinations. You have limited funds. You're making a choice between your child's life and a roof over his or her head. So Armstead-Barnhill has recognized that that's a need, and we've come to the forefront to try to address that need. We've contacted the medical institutions to say, hey, look, you know the community, you're treating them. Let us help you provide financial assistance for those particular type of emergencies. So the sickle cell community will come to, let's say, Children's Hospital or Nova Fairfax in Virginia, and will say, we need assistance in getting a Uber to the hospital. Well, they then will take Armstead-Barnhill monies and pay for the Uber ride. So then you don't have to worry about making that terrible choice between having food on the table or taking your child to the hospital.
Right. You know, you made me think just now, the treatment. I don't know how many doctors are educated enough to treat the disease like they have become with cancer. There's cancer treatment centers and all this around the country. How are people with sickle cell being treated? Do they go to centers? Because there aren't a lot of physicians that specialize in.
I'm so glad you asked that question. As I said before, one of the things that Armstead-Barnhill does is educate. And we're not just educating the sickle cell community or the community at large. We're educating doctors. And we're doing that by way of saying, look, you've got a sickle cell community here. They have special needs. Your staff needs to have the education and medical ability to treat the uniqueness of sickle cell, and also understand, and this is a problem, that when a person in crisis comes to an emergency room in the pain that Linda has described, you know, really intense pain, they are not drug addicts, and that is how they've been forced to deal and fight against the medical establishment. They're in serious pain, and the medical staff needs to understand that and develop a protocol that puts sickle cell in a priority status.
That's interesting, because I think I read that your daughter, when she had crises, and at one point she was being treated regularly at Johns Hopkins. Most hospitals don't have that kind of health services that they can provide the people. So that's a specialized place. Johns Hopkins, we know, is really, and so the average hospital may not even have anybody there in the emergency room that have seen it presented.
A lot of it depends on your geographic location.
Right.
You know, I do want to urge folk to understand that Armstead-Barnhill is not just in the DMV. We are national in scope in terms of our education and the grants that we give out, and the ability to provide information to those areas where there's not a significant population. I say not significant, but if you have one person who has sickle cell, that really is significant. So yeah, there are not that many institutions who have a very high level of expertise, but that can change. So we are very busy. That can change and should change and must change.
How long does an episode last? I'm sure it depends on the person, the severity.
Correct. But it can be as short as a few hours or as long as a couple of weeks.
Oh, wow.
So it varies from patient to patient. And then another thing is, what kind of treatment are they getting? Are they getting enough fluids? because that's very important for a sickle cell patient, making sure they get enough fluids in their system to help. And, so getting that education, knowing how to take care of your own self when you have sickle cell, and how to get the help from the doctors is so important.
Are insurance companies covering treatment for sickle cell?
Yes, they are covering it. I know way back when I was growing up, it wasn't covered because it was considered one of those high risk illnesses to cover. But now everything is being covered with the Affordable Care Act, things like that. So we just want to make sure that everything stays covered. It's very good.
That is good. So tell me about some of the grants that you have dispersed. Who gets them? How do you find who to give them to?
It's one of the best parts of our job here. We tend to listen to the medical community updates in sickle cell research and therapies, and folks send us articles, and again, we go out to the medical community and talk with researchers and ask them what they're doing.
Okay.
And folk let us know what they're doing and what the needs are. So if we find that there's a possible new treatment or therapy, we'll contact the institution with the researchers, talk with them, find out what level they're at, what stage of the project they're in. Then we present it to our board. Again, everything's volunteer. All folk are just doing this out of good-natured care. And then we make a vote and decide who's going to get the grants. And we have 2 major fundraisers a year, and that's when the grants are given out. Unless there's a dire request for a need. And then, we dig into our coffers, which we need to fill up. Because we get money in so we can give it back out.
Give it right back out, How many people are on your board?
12, I believe.
12, okay.
I say it because, we are actually in the process now of securing somebody else to come on board. And it's a varied board, and we're very excited about the composition of it.
Yeah, and I was just wondering because the board has to approve who you're giving the grants to, and I was wondering what that conversation is like with several people trying to all come to one consensus on who should get this grant.
There can be lively discussions. Definitely lively.
Yeah. What's and I know you're proud about every grant that you're able to give. Is there one in particular that you've given to a group that you feel extremely glad about?
Well, I'll talk about 2 really quickly. One, we were so excited to provide financial support for Dr. Jennifer Dowder, who actually discovered the CRISPR gene editing technology. She's a Nobel Prize winner for that technology.
Wow.
So we actually went out to California. I heard about it in the newspaper again, went out there, visited her facility, learned about everything they're doing, and financially supported some of their efforts out there in California. So that was exciting because, again, national in scope, a therapy that can impact the entire sickle cell community here in the U.S. and the millions who suffer in Africa and the Mediterranean and other places. Again, it's not just an African-American disorder. Another opportunity for us to give a grant that really hit close to home is that one of our medical institutions in the Virginia area sent us a letter from a sickle cell patient who begged us to support purchasing a vein finder, which is medical equipment that folk such as Linda and others who need frequent blood transfusions and get sick for all kinds of causes, it finds the vein, just as it's called, the vein finder. They didn't have one at a major medical institution, and they had the one they had to share with the cancer community, and the cancer community was given priority for use. So those folk in the sickle cell community were being stopped repeatedly because they did not have a vein finder.
Wow.
Armstead-Barnhill bought them one.
Awesome. Good for you. You know that we talked a little bit earlier about the fact that the funding for research and all kinds of things for patients for the sickle cell disease is not on par with a lot of funding that's being made available for other diseases. So it's got to be difficult for you trying to do this work.
Yeah, it's difficult. You know, you don't want any community that has medical concerns to suffer.
Right.
But you also don't want to see such disparities. So there, cystic fibrosis is one of the medical concerns that is considered a rare disease as well as sickle cell. But the funding that they receive from you know, governmental entities is so much more than the sickle cell community receives, yet their population is significantly less in terms of those who suffer. So we just want equality.
Yeah.
We want the monies to be spread as evenly as possible, and that all comes about with education and advocacy again.
Yeah, and like you're saying, trying to reach those people who can help with funds. You know, we just have to get the word out.
Get the word out
and let them know how much it's needed. So, is there a cure for this disease?
Yeah, there is. That's the good news. It's part of the CRISPR with the gene editing therapy, and what happens is they take stem cells from the patient, the sickle cell patient. They treat it, and then they can put it back into the sickle cell patient, and it's a normal red blood cell now. And it's not a sickled red blood cell. And so now that patient can then start making more healthy red blood cells and no sickle cells, and now they're cured of the disease, which is great.
But that sounds very intricate. And
it's invasive. So she said the good news is the problem is that it's $2 to $3 million per patient. And it's incredibly invasive. The patient needs to stay hospitalized for sometimes months at a time for the procedure. And then, you know, we're hoping that it works, but, you know, it's very new. And again, costly and invasive.
Yeah, but it is good. They're on the right.
We are very hopeful.
Yeah.
And the more we talk about it and the more we fund, the more we are able to come closer to an affordable, effective cure.
Right. So as we close out, for you, Andrea, what is your goal for this organization?
Okay, my number one goal is to work myself out of a job. My unpaid job is to work it out, to find a cure and to no longer have to advocate for a disease that is now cured and people are no longer suffering.
So how long do you think it may take to get there?
Well, thanks to shows like Solutions, I think we're a lot closer to getting there.
Yeah. So. Well, I just have to say the work that you all do is important, it's impressive, and very much appreciated by me, and I know the thousands of people who are affected by this disease. So I say thank you so very much.
Thank you so much. Give.
So I'd like to thank my guests, Andrea Armstead, co-founder, CEO, and Linda Armstead, technical support director of Armstead-Barnhill Foundation, for being on the show and sharing solutions that help improve the lives of people in our communities dealing with sickle cell anemia. If you would like more information about new therapies, research, or physician referrals, you can call the Sickle Cell Hotline at 301-875-1435. If you'd like more information about the foundation and want to support the work they do, then please visit their website at curesicklecell.com. I'm Cheryl Hawkins. Thanks for watching, and see you next time for more solutions.